For the record, my name is John Fitzgerald, District 3 City Councilor, and I'm the chair of the Boston City Council Committee on Public Health, Homelessness, and Recovery. Today is June 12th, 2025, and the time is about 6:20, if I'm not mistaken. 6:22. This hearing is being recorded. Written comments may be sent to the committee email at ccc.health@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of the hearing. Individuals will be called on in the order in which they signed up and will have 2 minutes to testify. If you are interested in testifying in person, please add your name at the sign-up sheet near the entrance. And is it still at the top?
Yep.
All right, so it's still at the doorway at the top of the auditorium there. Also, I know it is a little bit hot today, folks. We do have fans in the back and I believe up front here. So if everyone starts to get overheated and feels they need to cool down, you could try and step in front of a fan if you'd like. And there's some water in the back as well. Today's hearing is on docket number 0306, Order for a Hearing on Health Access in Hyde Park. This matter was sponsored by Councilors Enrique Pepin and Ruth C. Louis-Jean and referred to the committee on January 29th, 2025. Today I'm joined by my colleagues in order of arrival, myself, Councilor John Fitzgerald, and Councilor Enrique Pepin of Hyde Park, and at the moment, that is it. We'll now move on to opening remarks, and Councilor Pepin, this is your district and your docket, so I will allow you to please have an opening remark. Take as long as you need.
Thank you, Mr. Chair. I want to start by thanking Ethan and Megan and the entire City Council Central staff team for coming out tonight to set up this off-site hearing here in Hyde Park. Thank you to the Healthcare for All for supporting all kinds of public health efforts. They're located just outside of the auditorium with resources. Thank you to the Hyde Park Health and Wellness Center Steering Committee for keeping the effort alive with fresh energy, expertise, and care for Hyde Park. And of course, I want to thank the Hyde Park community, the residents, for coming out tonight to share their testimony on the subject and for advocating for the needs of their community. As we know, Hyde Park is one of the few neighborhoods in the city of Boston without a community health center. And boy, do we need it. Hyde Park residents have higher rates of diabetes, heart diseases, and other chronic and acute illnesses. Hyde Park ranks in the top 3 of the neighborhoods with the highest rate of diabetes-related hospitalization. Hyde Park, along with Mattapan, which is right next door, have 2 of the highest asthma emergency visits for children. It is very important for all of us here in Hyde Park to receive a center where community members can safely and securely access the resources they need to address and treat uniquely intense challenges our community faces. You know, I'm going to go off script for a little bit because as a kid growing up in Boston, the places where I went to go get care were the community health centers. Going to the Martha Elliott Community Health Center, to the Brookside Community Health Center, and being able to I have asthma, so I was able to get treated there for asthma and make sure that I was getting the right resources. And when I think about the children of Hyde Park and the residents of Hyde Park, seeing that they don't really have that opportunity. They have to go somewhere else. And we all know that the access to public transportation here is very limited, and some people don't own cars. So I want to make sure that we are all able to go to a community health center like I did when I was a kid. Now, I'm very excited to begin the hearing and look forward to reflecting the efforts of the community in my decisions at City Hall. Thank you all for being here.
Well done, Councilor. I would like to now introduce today's panelists. We have 2 panels today, just so folks know. The first is of the community, which is represented up here with us today, and the second panel will be from the Mayor's administration, and we will have them come up second, and each one we will do a round of questions with the councilors and then move on to the next one. In the first panel for the community representing, we have Dr. Nicole Christian Brathwaite. Could you just raise your hand so I know I don't know everyone. Nicole, how are you? Shannon Niles. Not yet, okay. Dr. Tia Martin. Hi, Doctor, how are you? Good to see you as well. Jessica Paulino. Jessica, how are you? Thanks for being here. Dr. Ashley Porter. Doctor, thank you. Sherma Pierre. Sherma, thank you for being here. Bill Hennings. Bill, much appreciated. And Marcia Kim Jackson. Marcia, thank you as well. I will now turn it over to the panel. I don't know if you guys have figured out an order in which you'd like to do things, or you can just start and go right down the line if you will. I assume, because we don't have anything set up for a presentation, you each all have about a 3 to 5 minute spiel you'd like to do, and afterwards we will do questions. So, Marcia, if you'd like to start,
Sure.
Go right ahead.
Thank you. Good evening, everyone, and thank you so much for being here. Thank you to the council for allowing us this opportunity to really advocate for ourselves and for our community. My name is Marcia Kim Jackson. I've been a resident of Hyde Park for the last 25 years or so, and in the midst of the pandemic in 2020, we had our first virtual meeting as a neighborhood group in West Fairmount Hill. And in that neighborhood group, we asked residents what they needed to see most happen for the community to really address the issue of equity. And health equity came to the fore in a small group breakout led by Dr. Tia Martin. And in that health equity small group, we learned that there was a strong desire for a health center in Hyde Park. And so that launched our work to make that request and now dream a reality. And we, the 15 of us, many of us are here, some of us are missing because of other commitments, but we are no less clear about what we want to see in Hyde Park. We, the residents of Hyde Park, respectfully are petitioning you, the community, and the City Council for your support and urgent action to fund and build a dedicated health center in Hyde Park. For decades, our neighborhood has faced significant health disparities and limited access to equitable health care. We are now one of Boston's expanding medical deserts. Hyde Park has endured, as you heard from Council Pippin, high infant mortality rates, high rates of asthma, and mental health burdens. And with over 9,000 residents below the federal poverty line, we're a richly diverse population, and we need culturally responsive and accessible health care close to home. We have begun efforts since 2021, I would say, in earnest, to build a health center. Our meetings are really mostly around policy and engagement driven, and our work is really to build awareness in the community and build momentum to have support for the health center. Our conversations have been with health leaders, if you will, Boston Medical, MGB, and the intent is to really establish a partnership with them to realize this long overdue vision of a health and wellness center in our community, because I believe we are really overdue and we are very deserving. Thank you so much.
Hi, good evening. Again, my name is Dr. Nicole Christian Brathwaite. Sure. Is this better? Okay. Thank you. Again, my name is Dr. Nicole Christian Brathwaite. I am a child, adolescent, and adult psychiatrist. I'm originally from Philadelphia, so I'm still an Eagles fan. I'm just going to put that out there. But I have been a member of Hyde Park for about 9 years. And this is important to me both personally and professionally. Hyde Park is an incredible community, an incredibly diverse community. It's a wonderful place to raise children, but as has been said, it's a medical desert. It is a completely underserved community. And when we're looking at the data, we know that communities with high rates of Black and Latino individuals also have higher rates and disproportional rates of untreated mental illness, untreated substance use and abuse, and the mental and physical health burdens that require community-based support and intervention. There was even a 2018 study that found Hyde Park had higher rates of anxiety, insomnia, and chronic stress. And we know for sure it's not getting any better in terms of our stress exposure. And ultimately, there's no health without mental health. And as we're thinking about building this healthcare clinic, we also have to think about integrating mental or behavioral health. And ultimately, there's nowhere for individuals in our community who are suffering from depression, anxiety, trauma, substance use. Our community recently faced an unspeakable tragedy, a tremendous loss. And there was nowhere for our community to go to seek support, to seek urgent behavioral health care, for parents to manage this trauma, for children to manage the trauma that we of our tremendous loss. And studies show that those exposed to traumatic experiences are at increased risk for PTSD, depression, substance use, and even chronic medical conditions. But the one thing that can make a difference is early intervention, is having access to these supports before you're in crisis, before you have to utilize an emergency room for unsafe thoughts, or becoming suddenly so depressed that you're not functional, or dealing with trauma in a way that it makes it hard, becomes pathological. A community clinic with mental health services would give families access to behavioral health, parenting support, crisis care, again, and therapy. And certainly on a personal note, 8 years ago, I gave birth to a very chubby 10-pound baby boy who is wonderful. But shortly after, I suffered from severe postpartum depression. And for months, I could not find anyone in Hyde Park, in Mattapan, nowhere close that would be willing to treat a postpartum woman suffering from severe depression. And after about 3 months, it got to the point where I became suicidal. And I'm a psychiatrist. I'm a full-fledged physician, and I could not maneuver our healthcare system, and I could not find care. And postpartum depression is the most common complication of childbirth, and people in our community are dying because they do not have access to therapists, psychiatrists, psychologists. And I know a lot of this we already know, but again, I wanted to drive the point home because I finally found a therapist 45 minutes away by car. And I know many of us don't have that luxury and don't have that access to be able to find someone 45 minutes away who would take insurance and would treat me so that I don't end up a statistic. Thank you.
Good evening, everyone. Thank you so much for being here, and thank you so much for sharing your story. My name is Jessica Paulino. First of all, I'm a mother. I'm a Hyde Park resident. I'm a community doula, maternal health advocate, and I'm the founder of the EMA Project, which is a loss and bereavement organization right here in Hyde Park, supporting pregnancy and infant loss. I'm also a mother who has experienced loss, which is my why. Access to care is really important. Hyde Park has the highest instance of infant mortality rate. Our population is majority Black and Latinx. And we know that the majority of Black birthing people, Indigenous people, Latinx people are facing 3 to 4 times the mortality and morbidity rates than our white counterparts. That is my why. That's why I think it's important to have care right here in our communities. Like Sherma, I also experienced some mental health issues, postpartum depression, postpartum psychosis after the loss of my son, Eddie Manuel, who passed away at 22 days old in the NICU. And I found myself as an educated woman who spoke English, who was fluent in the language, also without access to care. And also without access to culturally competent care and with providers that would listen to me when I was pregnant and I was saying that there was something wrong, that I felt something was wrong and I was unheard in that. And I think the difference in that would be if I was treated in my community and had relationships with my care providers where I just wasn't going to a hospital and was just a medical record number to someone, but that I'm actually a person connected to my community, that loss impacts everyone around you. And it is why I'm also a community doula here and offer services at a sliding fee scale, because I don't want anyone to go without advocacy or care. I'm really grateful to be part of the steering committee and to share testimony with you all today, because this work matters, we matter, and our lives depend on this. Our lives depend on this, and I want to make sure that that is heard. Thank you.
Good evening, councilors, as well as fellow residents, supporters, and friends. Oh, can you guys hear me now? Yes. I feel like a Verizon or Sprint commercial. Can you hear me now? Can you hear me now? Okay. So good evening, council members, our fellow residents, supporters, and friends of Hyde Park. My name is Sherma Pierre. I moved to Boston 22 years ago. 16 of those years have been spent in the Hyde Park neighborhood. I am here today as a member of the Health and Wellness Steering Committee, but more importantly, as a concerned resident of Hyde Park to voice my support for bringing a health center to our neighborhood. Now, this is not something, councilors and friends, that's like whimsical for me. It's not something I decided on that's needed a year or two, or even 5 years ago when we were at the height of the pandemic. This is something that I have felt passionately about ever since I moved to Hyde Park so many years ago. See, at the time I moved to Hyde Park, I worked at Boston Medical Center. My primary role at Boston Medical Center was working with the licensed and affiliated community health centers. That was when I first learned about the important or the critical role that health centers play in improving the health and wellness of their patients, their families, as well as of our overall communities. I would go to so many meetings and trying to figure out, because I know in Boston there are so many health centers, but it dawned on me only after I moved here, hey, why not Hyde Park? Why not Hyde Park? Why do we not have a health center in Hyde Park? Knowing the critical role and services that they provide, not only in healthcare, dental, eye, but also the overall wraparound services that they provide to the residents of the neighborhood. I just wanted to also mention, for those who do not know, the very first health center in the nation was actually founded in Boston at Columbia Point in Dorchester. And I am mentioning this since the founding of the health center movement, have been serving as a medical home to provide all the services that our residents need. I will also go as far as saying that one of the things that happened when I moved to Hyde Park many years ago is realizing my commute from home and even to doctor's appointment was very difficult. And some of you might know this, but for those of you who do not know, let me give you a quick snapshot of what it might look like if you live where I live, trying to get to any appointment. And it could be BMC, it could be the Brigham, it could be MGH. You take the number 24 bus to Mattapan Station. You take the trolley to the Red Line. You take the Red Line to Ashmont. And you take a bus to BMC. It's no different if you take the bus. You take the number 24 bus to Mattapan Station. You could take the 28 bus to Dudley. From Dudley, you get a number for the buses to get to your appointment. Even today, the MBTA trip planner, you could go ahead and plug it in to figure out your commute to so many appointments. And an appointment right now from Hyde Park to BMC to the Brigham is going to take you at least an hour to get there. Now, one of the things I will say is for some people, they might say, okay, an hour is not that bad. But if you're elderly, if you're a mother with a young child pushing a stroller, and if you're not feeling well, the worst thing you want to do is to be commuting via public transportation. And no, not everybody have money to take an Uber to their destination. So keep that in mind when we think about access. So yes, while there are a number of health centers in Boston, not everybody have the same equitable access to get to the doctor's appointments. After leaving BMC, I actually spent 12 years working at the Brigham and Women's Center for Community Health and Health Equity. And even as part of that role, I oversaw our data and evaluation team. And that's why I really got into the nitty-gritty of the data. And I'm looking at all the disparities, and Councilor Pepin, you mentioned it, and others on this panel have talked about the disparities in healthcare. right? So in the most recent Boston Public Health Commission Health of Boston report, it might show that while the average adult in Boston stands at a 4.9% diabetes rate, in Hyde Park it's 13.9. The rates of cancer, morbidity, and mortality is also extremely high in Hyde Park. Chronic disease is also on the rise in Hyde Park as well. Now, here's the thing I'm proposing. A health center is not a magic bullet, but we should have a health center as an arrow in our quiver as part of our long-term or short-term strategy to make sure that everybody in Hyde Park have access to equitable health care. One of the things I have come to realize as well, since I've been living in Hyde Park and from my different involvement, either through work or volunteer opportunities, people always say, oh, there's this perception that Hyde Park is okay. Hyde Park is okay. But no, the data speaks for itself. I challenge you, look at the data. I am extremely thankful to our Councilor Pepin, as well as our State Representative Rob Consalvo, who work every day tirelessly to make our neighborhood better. And I thank them for their support, for trying to make sure that we have the resources that we need and being part of this work that we are doing. And I urge you, Councilor Fitzgerald and everyone else, to be a partner with them in that work to get us the help that we need in Hyde Park. So thank you for your time and thank you for coming out. Thank you, everyone.
Good night, everybody. Can you hear me? Cool. Dear committee members, residents, and friends, I hope this message finds you with an open heart and listening ears tonight. My name is Dr. Ashley Sharp-Porter. I am an educator and a researcher, and I am a lifelong Boston native and current Hyde Park resident. I come before you to advocate for a long-needed Hyde Park comprehensive medical center. Excuse me. Hyde Park is a vibrant community, vibrant and diverse community with many businesses that are thriving, many organizations, as well as many restaurants and churches. But it still remains underserved when it comes to accessible and affordable health care. Many residents like myself face lifelong wait times, limited transportation, some of which my colleagues have mentioned, and barriers to specialized health care. These challenges have only intensified in recent years, particularly for the elderly population, families with young children, and those managing chronic conditions. As a current resident, I have to travel across the city through traffic to receive quality health care. For a breast cancer survivor like myself, it is not ideal with the number of appointments that I have each month to travel for countless hours in traffic across the city to Brigham and Women's or to Dana-Farber. Having quality primary care right here in Hyde Park would be life-changing for me. Furthermore, as someone who is currently childless but has recently undergone the IVF process, I am seeking to start a family soon, almost immediately. And I need the healthcare to be closer, right here in my community, near to my house. I know that there have been many institutional challenges that have prevented a town with majority Black and brown residents to have proper attention and investment from hospitals, some of which Sherma has just mentioned. However, I am hoping that you all would make funding and space your top priority for a medical center that could provide our community and families like your own with culturally responsive, high-quality services such as prenatal care, such as preventative screenings for conditions and diseases like cancer, for primary care, and also mental health services. Thank you.
Hello. I appreciate the opportunity to speak this evening. My name is Bill Henning. I'm on the committee I'm also director of the Boston Center for Independent Living, which provides services to about over 4,000 people in Greater Boston. We have an office in downtown Crossing and Fields Corner. A lot of what I might have said this evening has already been stated by these experts that sit with me. But I will note that in Hyde Park, there are approximately 5,000 people with disabilities, roughly 13%, I think, of the, let me see what it was. 13% of Hyde Park residents have a disability, which is over 5,000 people. We are seeing in Hyde Park something very positive happening to the development of housing. We're not rejecting housing. We see a new development going right up in Cleary Square that will be for seniors. We have the Pride right around the corner for older people. We have Blake Estates. We have the Fairmount housing development. What we don't have is proximate health care, and it's very important. I think we've heard about the significant need around mental health concerns. We have higher rates of suicide, higher rates of anxiety in our population. I think it's roughly 9% for each of those categories. The transportation issue is quite real. My very good friend and colleague, Chris Hart, lives in Hyde Park. If he goes down to get his care at BMC, he's taking a bus and transferring at Forest Hills or getting off at Ruggles from commuter rail, which is not necessarily the thing you want to do if you're not feeling well. Lastly, I think we're very aware that much of what we would consider a safety net is under aggressive, insensitive, harmful assault from the administration in Washington and from Congress in Washington. It will be deadly for low-income people. It will be deadly for people on Medicaid, and we are going to need more health care in our communities. As we lose potentially $1 billion in Medicaid funding in Massachusetts, we are going to have to think of how we serve the people right in our own neighborhoods. Otherwise, we're going to have health care for people who can afford it and not near as much for people who can't. And that's where the community health centers are going to come in. I know there's a real concern about funding because they're Medicaid dependent, but that's where the city, the state, and all of us have to pull together. And I think we're really going to need more care in our communities in the face of the loss of Medicaid, SNAP, loss of HUD benefits, Section 8, which may produce more unhoused people. So we are looking at a crisis, and we're going to need to work locally in our neighborhoods. So thank you, and thanks for your consideration.
Happy Thursday evening, everyone. It is a pleasure to be here with you. Thank you for this opportunity to share the challenges as well as the opportunities that we have in Hyde Park to make sure that all residents have what they need in order to thrive. Health is one of our biggest assets. And from with listening to all of my fellow steering committee members, you heard about the data. Now, there's one data point I want to reinforce, because we say we love babies, we say we love children. We have the highest infant mortality rate in the city. Our babies are dying at the highest rate of any babies in the entire city. And then you layer on top of that what we've learned from the state. I'm going to share this with you. So we've talked about babies, and now I'm going to talk about mothers. So according to the Massachusetts Department of Public Health, Black women in Massachusetts are 1.9 or 2 times more likely to die during pregnancy or within 1 year postpartum compared to white women. So when we talk about children, mothers, we're actually at a place where we should be talking about crisis, disaster. So as someone who formerly worked in government, in emergency management, public health, climate resilience, all of that stuff. When we talk about crisis or disaster, the official definition of a disaster is that the local capacity to deal with the problem is overwhelmed. In other words, we need external help in order to address what the issue is. And in Hyde Park, with babies dying and mothers dying, that is a disaster that we need to develop the resources, shift our thinking in order to make sure that we are able to have the kind of quality health care that will reduce the burden of our community of deaths of babies and mothers. And I'll end with this. I've been a resident for going on 18 years. My youngest daughter is 17. I gave birth to her after 3 months of living in Hyde Park. And during that time, I almost died. I was in a coma for the first 2 months of my daughter's life. So in thinking about all of the subsequent appointments I had to go to, all the subsequent appointments I had to take her to, all of the subsequent chronic illnesses that I already had that I was managing, the amount of commute time that it took for me to go back and forth to all these appointments. As someone who had a job, I'm married, I have resources, it was such a burden. The amount of time I had to take from work, the amount of time I had to take from spending time with family to deal with all of these medical appointments. Now, if we shift, this isn't about me personally, right? This is not an uncommon story. My husband had a colleague who had a baby a week after I had a baby, and she passed away giving birth. This is not an uncommon story. And so I want to just wrap up by saying, in terms of opportunities and what we can do, we've talked about a health and wellness center being an opportunity for us to address the fundamental core challenge of access and supporting folks in the community where they live so they don't have to deal with such a challenging commute to get to care. But we're dealing with a situation where if we don't take action, if the city, if the state, if we don't come together as a community in order to take action, we are perpetrating something that's called institutional betrayal. Now, our colleague over here, who is our mental health expert, has shared with you the information about the mental health issues at an individual level. But institutional betrayal is about how institutions cause harm or do not take any action when harm is caused for people who depend on that institution. We depend on our government. And when the government and other institutions, in this instance healthcare, ignore the death and pain in our community, they're perpetrating institutional betrayal, which is a documented type of trauma. And it is such a painful type of trauma because you keep experiencing it because you can't get away from the perpetration of the harm. So for us, in our community, I hope that we are not willing to settle. There's a quote that I'll end with, which is, I'll tell you where it's from. I'll share the quote with you, then I'll tell you where it's from. People will settle for anything just to say they have something. And I don't want us to be those people. I don't want us to settle just for anything to say that we have some kind of health care or some kind of access. We need the kind that we need, period, end of story. And that quote comes from The Queen's Gambit, a series. I know, very pithy from a doctorate, right, person. But at any rate, I'm hoping that you will join us in the fight, in the struggle, in order to get what our community needs, what we deserve. Thank you very much.
Thank you to our panelists. And I'd like to also acknowledge at this time that we have been joined by Council President Ruthie Louis-Jean and City Councilor at Large Julia Mejia as well. Thank you guys for coming along. I will now turn it over to the sponsors to begin with the first round of questions for this panel, and then I will turn the floor over to my colleagues in order of arrival, which just so happens to be in order of the sponsors anyway, so I think we're going to be okay here. Council Pepin, questions for you.
Thank you, Mr. Chair. Before I begin with my questions, I do have a message from your state representative and your state senators. So State Representative Rob Consalvo, the second best District 5 City Councilor, just a joke. He's over at the Archdale Public Housing Facility right now. He's sponsoring Hot Dog Night, but he wanted to let you know, all know that he very much supports this initiative, and he's doing everything possible at the State House to make sure that we are receiving state support as well. So thank you, Rob Consalvo. From your State Senator, Liz Miranda. State Senator Liz Miranda passed an amendment in the recently signed economic development bill that put $1 million towards acquiring a space to house a community health and wellness center. This amendment was earmarked to the City of Boston and could be used for a feasibility study. We have 5 years to figure out how we can use that funding, and of course, the Senator hopes that it doesn't take too long. Thank you, Senator Miranda. And I wanted to share a fun fact. Now, when my team was doing research about why do we need a Hyde Park Health Center here in our community, we actually found out that the first black woman to ever become a doctor and practice as a doctor in the entire country, in the entire United States, she practiced right here in Hyde Park. And her name is Dr. Rebecca Lee Crumpler. She practiced during the Civil War. She wasn't born here in Hyde Park, but she's buried right at Fairview Cemetery. And the fact that we still don't have a Hyde Park, but we have the first ever black woman to practice medicine as a doctor in our country, then we should change that. Which is why I'm so happy to see this panel, because you are representative of that. And it just shows that representation really matters, especially in our health careers. Now, that leads me to my first question to you all, and I think you touched a little bit on this at the summit that you had at the Pride not too long ago, is what type of health center do you envision? Literally, what's the type of building that you envision? What kind of message do you want it to give to the community? Anyone can answer that question.
My colleagues are looking at me because I've been so mouthy about this issue, and you and I, Councilor, have been talking about this. But one of the things I talk about is the ways in which we demonstrate care for our communities and value for the people who live there. And I make the analogy of driving down Route 9 one day to go to Framingham, and on the way from Route 9, getting on at Chestnut Hill, at the plaza there, driving down Route 9, I passed by 3 very large structures, all health centers: Wellesley, Newton, Brookline, all very large buildings. And they're actually owned by MGB. And I thought to myself, this is interesting. Within the space of, I don't know, probably 3 or 4 miles, there are these 3 buildings. And so what does that say about the value for health in predominantly white communities and the value for health in predominantly black and brown communities? And so for me, my vision for a health center is to have an edifice that says that we value our residents, that for every possible service and specialty that we need primarily in this area, primarily meaning the ones that we talked about that have huge disparities and huge statistics that say that we're missing something, those are the ones that are presented. So my vision is, I've gotten kind of granular, Council. I've gotten as granular as saying I want a 6-story building with parking, a coffee shop in the lobby. I've gotten very granular. I want mental health, I want maternal health, I want pediatrics, I want gerontology. Yeah, I want it all. And I want a fitness center on the first floor, has its own gym. Yes, I want it all because we deserve it all, right? And why should we settle for less than we really deserve and need in this community? We are gold. Look around. Look at the people who live here. We are gold. We are beautiful. We are vibrant people working, contributing to the bottom line of this state and this country. why can't we have the care to help us do that and to help us serve our families and live lives that we can enjoy like anybody else? We deserve it. And so I have this vision for something really grand and beautiful. I think we're going to get it. What do you think? Nobody else has a vision?
Yeah, you were good.
In addition to all of the basic necessities and luxuries that Marcia just named, something that's important for me in a health center would be physicians and mental health practitioners who share the same race, culture, ethnicity as myself and the rest of the Hyde Park residents. I was being seen many years ago, maybe 8 or 9 years ago in Dorchester, and at that health center there were a number of white physicians. I had been asking for a mammogram for over 3 years, and even until the day that I got one, the doctors had told me I was too young. They did not listen. They told me my breasts were too dense, and they cited all the different research to not provide me with the care that I was asking for. However, I have found since then, with my choice of very slim physicians of color, I have felt a lot more affirmed when I'm being seen by them. I have felt a lot more heard when I'm in their offices, and so that is absolutely important for the residents here, especially as we, come here as a predominantly Black community. Thank you.
Thank you so much for adding that. I also want to add that we have a vision for having wellness in this space, that it's not just about Western care, that we also want to integrate different types of care. We have the Boston Acupuncture Project, which sits on the steering committee here. So having other options for care, traditional Chinese medicine, things that we know have worked for centuries for folks and that provide more holistic care is also a desire for this health and wellness center.
Councilor Pippin, I feel like right now, like I'm in a classroom and I'm going to say, they took my answers. That's all I was thinking about. But I think overall our vision for Hyde Park Health and Wellness Center is a place where people can go and get comprehensive, accessible care at the time that they need it. One of my former bosses would always say, you could pay now or pay greater later. And the more people have to delay care for various reasons, be it access, then we are going to pay now, not only personally, but as a neighborhood and also as a city. So for me, my vision is having a comprehensive community health center where people can get access to the care that they need when they need it. And then, as we know with health centers, the way they're designed, there is always there is a governing board that is made up of residents, right? So the majority of people on that advisory committee is made up of residents. And I envision a health center with all the things that Marcia was saying, but also making sure that we stay true to what it is that our community wants, with a board, with direction from the community to ensure that we are constantly providing what it is that they need from us as a health and wellness center.
Thank you, Sherma. I just want to add, so the last thing I want to say about this is that one of the things that I have been very verbal about is my frustration, and I really have disdain for it, but I'll say frustration because I want to be really kind. But this idea of the edifice, the way it looks, really came to the fore when I thought about if you have driven by the Shaws and there's a building with a sign outside of it that's set up by MGB that says Hyde Park Health Center. Whenever I go by that building, I get really incensed because it's a storefront, yes? And I cannot imagine that anyone could think that that storefront could service 30,000 residents. And I get really angry and incensed because I'm thinking if you can build a huge building in a Wellesley, Brookline that's 6, 7 stories high, but build me a storefront, tell me that's disrespectful. So here's my request of you as you're sitting here today. Every one of you, if you could join us in writing to MGB, and I'll give you the information, and tell them that you refuse to call a storefront a health center, that you want better, you deserve more, and you're going to fight for more. I'm going to ask you to do that with us, because we here, there's 15 of us, we meet monthly, we work hard, but we cannot be the only voice fighting for this health center. We cannot be. It won't work. It won't work. We have families and children, we have lives, we have health issues we want to rest, and we need you to come alongside us. So we'll give you the information. If you leave your information out front, we'll email you who to write to. MGB, tell them we want a health center, we want more and better. Make that place that they have on Hyde Park Avenue something that we can be proud of and they could really service us with.
And I will quickly add, because all the other things were said, but two things that I think are really critical. One is that in addition to having a physical space, it has to be designed in a way where we're going out into community. So we need to be able to bring care out into the community. So if you know about some of the other health centers or some of the hospitals, they have mobile vans, they go out, they're constantly interacting with community. And we need that in Hyde Park. And then the second part is, I'm putting my climate resilience hat on, that when we build this building, that it is a model for reducing our carbon footprint, for generating energy, clean energy that can help the community reduce all of our different electricity bills for folks who are in the vicinity of this community health center, and that it is a place where we're able to organize and have community space in order for us as residents to continue to do meaningful work, because there's always a fight that we need to have, and we need to constantly be organizing to make sure that we are on the same page and that we understand all of the different needs in the community. Because what we know is that power without accountability is a recipe for disaster. So we always have to be organizing to hold all the different institutions accountable for how we interact and what we need from them.
Thank you for those amazing answers. I couldn't agree any more with those. My last question for you all is, has there been any type of relationship with partners in terms of hospitals, medical professionals, healthcare providers? What conversations were had and what were the results of those discussions?
I have to start, y'all, because Marcia said so. We've spoken with the Mass League of Community Health Centers in order to think about strategy and approaches and what does it mean, what does it take in order to establish a health center, what are all the different ways that we can approach it. We've also had in our health and wellness summit, we also had a number of our local healthcare practitioners there, including Lowney, healthcare providers there in order to talk about ways that we could collaborate on what the vision could be and the ways that we can partner. But I think those are the main ways. And we've also learned from the South End Community Health Center as a grassroots started organization, as well as we're in the process of going out to East Boston Community Health Center to learn more about how they're operating and how they were started.
Yeah, thank you for that. Now let's add, yes, and by the way, before I speak, I do want you to please acknowledge and thank the rest of our team sitting down there. Could you all just stand in the blue shirts? That's the rest of our team, and there's 2 people who are absent, 3 people who are absent. And they have stuff to say too, I'm sure they'll speak, but I just want to say, in terms of our work with other entities, our desire is for partnership, and if you know anything about the process for a health center, and Mary Ellen is not here tonight, but the first part of the work is for us to get a groundswell to establish a need, both with data and with you all saying that we need this, and the second part is for us to find what we're calling a dance partner, which is a provider, like an MGB or a BMC. And then they will help us shepherd this whole idea of what the building will look like, acquiring the building, the services that'll be there, but we need that dance partner. So the advocacy that you're going to provide with this letter is part of that work of getting our dance partner, getting our provider. And so we've met with MGB on a couple of occasions and have asked them to do this work, and they're hemming and hawing. But we know what happens when people hem and haw and they get pressure from the public, right? Yeah? Yeah. So that's why we're asking you to write, because they'll hem and haw in secret, but we just need you to let them know that you're serious, and we're serious, and we're not going away. We've also reached out to BMC and have had not much response. We won't put them out there, but we are waiting for someone to come to the fore. And then, as Dr. Martin mentioned, we've been talking to other health centers just to learn, because we know we have a lot to learn. So we've been having cross conversations with different entities and health centers, because we believe that this work is going to happen in community, in collaboration, and with people who really believe in the vision as we do.
And I'll just add that in the meantime, we've also started conversations which happened at our summit this year about bringing mobile services to the community, because we're one of the only neighborhoods that is not getting an MGB van that comes out to provide services or testing, and so that is something that we are currently in conversations about to provide services in the meantime.
Thank you for those responses. And in those answers, I also heard the shout out to the South End Community Health Center.
Yes.
Fun fact, Divina Masso, a Hyde Park resident, Jose Masso's wife, helped build that up. So I just wanted another Hyde Park connection there. But thank you so much for those.
Can I just say something about Davina?
Sure, yeah.
Just want to quickly say, Davina Masso is one of the giants in our community, married to the wonderful Jose Masso, and mother of the Jose Fabio Masso, who's our chief of human services for the city of Boston. And the story about Davina, part of the reason why I'm so stoked about our work together is because Davina shared that the South End Community Health Center started in a very similar fashion. People like us, they got together and they were able to mobilize and build their health center. So just know that what we're doing is possible.
Absolutely. Thank you. Thank you for your responses.
Thank you, panel. Council President Ruth C. Louisiana, the floor is yours.
Thank you so much, Mr. Chair, and thank you to the lead sponsor, Councilor Penn, for bringing us out into community. Thank you to everyone for being here and to being part of this discussion. It matters a great deal for me as someone who grew up just a street over. We're on Metropolitan. My parents live on Lexington, and I know that Hyde Park deserves what every other neighborhood gets. And I know when there are emergencies, there's a dearth of hospitals and places where people can go. What we have in our area, I love the fact that we have the Mattapan Health Community Center. It's not as big as we would want it to be. We have the Kearney closure, where a lot of residents, a lot of black and brown folks, a lot of people in the area, when you have an issue, you go to the Kearney, and we don't have that as much anymore. And so this is an incredibly important conversation, so I want to thank everyone, of course, the indomitable and incomparable Marcia Kim Jackson for your leadership on this, but also to everyone who is also bringing in their own personal stories, right? It's so unfair that we have to share so much of ourselves in order to get health equity, in order to get health parity. I'll just say that the biggest killer here is the profit model in healthcare. And in this current model, I'm walking in here and I get these flyers about Medicaid and the cuts to Medicaid. And so, as much as I want a health center here tomorrow, I think that the industry right now, there are so many tremendous challenges in the industry. So I just wanted to just preface questions with that. And I also want to thank our incredible central staff for being here and for bringing us out into community, and also want to thank the Boston Police Department for being here and making sure they're centered in community as well. So just wanted to thank them for that. If we're not taking care of our wellness, we're looking after our illness. And I think that in Hyde Park, there's I want to thank Councilor Penn for his work on this. Previous Councilor Ricardo Arroyo also worked on securing the initial seed funding but it's been slow moving like molasses. And I'm wondering, and Marcia, I see and I'm with you in your grand vision for what a health center in Hyde Park could look like. we were just in discussions, including Councilor Fitzgerald, about what a new health facility would look like in Dorchester post-closure of Kearney, realizing how difficult it is to have hospitals in these day and ages. So if I were to ask you what people think are like the top 3 or the top 4 healthcare needs that you would want the center to address, that's something that I would find incredibly helpful.
I mean, I'll say again, mental health. And I say this all the time. There is no health without mental health. We often separate the two, and one, it creates stigma, but two, it also ensures difficulty with access. And again, when we look at the rates in our community, suicide is the 3rd leading cause of death in Black boys aged 10 to 24. And the rates of suicide among Black and Latino children have increased almost tenfold over the last 10 to 15 years. And a couple of years ago, I worked in a clinic in Newton, and we developed partnerships with the schools in Newton. And so our primary referral source were children from those schools, where they could walk over to the clinic during lunch, after school. And we partnered with the school counselors. And we know many of the schools in our community are understaffed with school nursing. Some have no school counselors. Some have school counselors that are split between 3 to 4 schools. And our students are under stress. Our students are dying. And so I feel like, child psychiatry, child behavioral health, but certainly all mental health is, I certainly would say, top 3, because it has to be integrated healthcare.
Can I just do a follow-up on that? When you say mental health, are you also talking about like inpatient beds for folks who are experiencing crises?
No, so I was thinking specifically outpatient. So we could expand it with outpatient therapy, outpatient psychiatry, potentially groups, and then having case managers, having social workers and therapists that can help refer to higher levels of care, so people aren't just sitting in emergency rooms for 8 to 15 hours. In a grand world, if we're thinking really big, urgent care would be amazing, but I wasn't specifically thinking of inpatient. That's an entirely different animal.
Mm-hmm. Sorry. I don't have a lot to add. I think for me, I think back again when I spoke earlier on, just talking about the founding of community health centers, which, the first one being in Dorchester at Columbia Point. When we look at the well-established health centers in Boston, be it the Mattapan, the Whittier Streets, East Boston, one of the biggest in the country, it did not happen overnight, right? I do not expect us to have a big, fancy, glossy, although Marcia envisioned it, and we went together in our visioning board. I don't expect us to overnight have, a glossy, fancy building tomorrow or even next year. And to your point, Councillor, there are so many challenges that we are seeing with potential cuts to Medicaid and so many things that's in our current environment that's threatening health and wellness and everything else that we hold dear. To your point as to some of the things and to what my colleague Dr. Nicole said, mental health is something that we know is desperately needed. And it's something that I think a health center in Hyde Park could provide. Dr. Atiya Martin talked about the maternal health crisis, the disaster of it. So it could be something that we can say, let us address maternal health. Let's address mental health. Councillor Pepin, who talked about even chronic disease, be it diabetes and heart disease. That is something that we could address, or even urgent care. We are not naive. We don't expect to address everything right now, but at least we're looking to you guys to help us to start. Mattapan Community Health Center started as a trailer. They had a trailer on Blue Hill Avenue when they started. We might not want a trailer, but we might be able to start small and grow. So our vision is to look at the health data and say, what is most needed now? What do we need now? And we've heard it all from mental health, maternal health, chronic disease, and maybe even urgent care. And as funding grow and things get better and we position ourselves, maybe we could have that nice big 6-story building with parking below and a Starbucks coffee and everything else. But we want to start. We need to start somewhere. And we don't want to be, well, we don't have the money for things. Where do we start? And that's what we are hoping that you, our councilors, can work with our city councilor on to make some of those things happen.
Thanks, Sharma. The only thing that I would add to the mental health, the maternal health, would be primary care with specific preventative screenings, as well as holistic care for our residents. As Dr. Martin mentioned, and also Sharma have mentioned before, Hyde Park has the highest rate of maternal mortality right now. It has the highest rate of chronic diseases for Black and Brown communities, as well as the highest rates of cancer. And so I do believe that the preventative screenings and care and primary care for residents will be a game changer for the Hyde Park community. Thank you.
Awesome. And finally, I just want to add a comment, and I want to give a shout out to the education that I got from one of our colleagues who's unable to be here tonight, Dr. Alicia McGregor, professor of public health at Harvard School of Public Health and health equity expert. And she put a bug in our ear before she had to travel, and she talked about this whole idea of having contingency planning, knowing what's coming down the pike with cuts to Medicare. We are actually going to be going into a strategy session to talk about how we can strategize to have care being accessible to our neighborhood without the health center or in the interim. So things like more mobile vans we talked about, and we'll be working on that. We welcome partners to help us do that, to make sure that's a reality for us in this year. We think it can happen. Your mobile vans that are happening now, we can have those be in Hyde Park more frequently, and that will provide for us in the interim services and support until we get our health center. So we have thought about contingency plans and what's this plan B. Councilor Julian, we have.
Just thank you for that answer. I think I heard mental health, outpatient mental health, urgent care, OBGYN, primary care with preventative screenings as sort of like the top. And I just think, like, again, where it starts from, maybe it's just finding one partner to do one of these things and starting there. I selfishly, I think mental health would be a great place to start. But thank you. Those are my questions now for this panel. Thank you, Mr. Chair.
Thank you, Council President. Council Mejia, you have the floor.
Thank you. I am happy to be here with you all, and I just want to thank everyone who showed up, because that is half the battle, is showing up and demonstrating that Hyde Park is ready, and you know what you want, and you want it now, right? And so this is how you show up. And I always say that Marcia is the #1 organizer, so if you know anything about organizing, Marcia will get you to show up and show out, and sometimes doing a little bit more than that. So since we've been at this, Marcia, now, I think for you brought me here under false pretenses when you first invited me to be I don't know, your racial justice conversations, and then you got me into this conversation, and you just know how to get things done. And so I just want to commend you and to thank you and how you've continued to organize and bring more people into this space so that we can understand what this moment is all about. So I grew up very privileged in the sense that I grew up with a community health center. My community health center is Dorchester Community Health Center, and that's where my daughter, who's 15 years old, is getting her care since she was a baby. And so there is something to be said about what it feels like to have a community health center that you can literally grow up with. And they've gone through their renovations. They didn't start off as like a little trailer, because when I was there, they had like a little building, but they scaffolded and they've grown, and now it's a multi-service center. There's a pool, there's programming, there's WIC, there's everything in one place, right? And so I think to your point of like, how do we grow into what we want is part of the strategy to get there. And I think that's what I have seen. And, you know, that's right, clap for that. That's what I see. We're going to grow into it. And, you know, and I think Councilor Louis-Jean said it best, is that sometimes we have to share so much of ourselves just to get what we want, but we deserve good things without having to do that. And for me, I had gestational diabetes when I had my daughter, and so I had to take insulin while I was pregnant. It was I was a high-risk pregnancy, but again, going back to, I had a health center. I also had a midwife, right? But it was still a very traumatic birth, and I was forced into a C-section because I was a woman of color. I really didn't know how to fight for my rights, and they took away that privilege of me being able to have my daughter in a natural birth. And that is, when we're talking about culturally competent care in the Black and brown maternal health, those are the sort of things that I wish that we had right here in Hyde Park. And so I'm here with you all. I came here just to let you know that I didn't even have to come here because I've been here, but I'm here for all of it. And my question is, for those, like, where are you, how far are you driving in this moment to get care? For those folks who live in Hyde Park, what is your health journey to get the care that you need? What does that look like? Oh, y'all don't go get doctors? What's up?
I'm Dr. Ellen Scalise, and I've lived in Hyde Park for 8 years, and I joined this committee about a year ago. And if I want specialty care, then I have to go into Boston. And that used to be simpler because I had a car, but now my husband and I share a car. And so that means that the only day that neither of us need the car is a Friday. And trying to say to somebody, I need my appointment on a Friday, means I could wait months and months and months. I do my PCP through Greater Roslindale, but they're going through a lot of changes right now, and they've had several of their primary care doctors leave. And so I don't actually know who my doctor is anymore. So it's difficult. It's very difficult. And earlier when we were talking about the things that we wanted to focus on, I think one other need that's big in Hyde Park is geriatric care. We are a seriously aging community.
No, talking to the mic so we can hear you better.
We are a seriously aging community, and we need geriatric care. There are a lot of people in Hyde Park that are elder. They have chronic conditions, or even they have new conditions due to their age, and they cannot get on multiple buses and trains and take the MBTA to go in and see a doctor. They don't have the resilience, they don't have the strength, they may not have another person to go with them, they may not physically be able to do it, so we need to serve that community as well.
Thank you for that. Thank you for that.
I live in a multi-generational home, so our care is all over the place. My mother lives with us and is recovering from lung cancer, as well as multiple chronic diseases. And all of her care is at MGH. And she had an appointment this morning with her primary care doctor at 9 a.m., and the ride picked her up at 5 a.m. And often they're late. And so she was supposed to be picked up from her appointment at 11 a.m., and the ride arrived at 1 p.m. And so for a 9 a.m. appointment that lasted 45 minutes, my mother was gone for hours. Or I have to take off work and basically take a half day in order to get her to her appointments. And she does have complex care, but how wonderful would it be if they had a satellite clinic where they could still share the electronic record and she could access her PCP 10 or 15 minutes away and not hours away, and relying on, truthfully, the not always reliable ride services. My kids, I wanted them to have a pediatrician of color. So we go to Atrius Health in Braintree because it was the only place I could find a Black pediatrician who took our insurance. And I can keep going on and on and on. I have to go get a mammogram, and because I have to go through Atrius, my options are like Kenmore and I think Wellesley. That's it. I have no other options. My husband has to get a colonoscopy, and he has to either go to like Back Bay or, a couple of other locations. But again, nothing is convenient, nothing is local, nothing is easily accessible.
Yeah. Go ahead. Dale, dale. No, dale.
Similarly, so I have, thankfully, a woman of color as my PCP, which I have to drive 45 minutes to see her. She is part of the MGB group, and she recently left. She's been my doctor since I was 22 years old.
Wow.
Not only did she leave, but she took 7 doctors with her. So now that practice is closing. A full practice at MGB in Chestnut Hill is closing because doctors are moving and they're dissatisfied also with the care and how they're being treated in this hospital system. So now I have to drive to Wellesley, which is not convenient at all. I'm also in an intergenerational home. My mother gets her care in community health centers in Jamaica Plain, thankfully, who offer her senior programming, who she very gladly goes to 3 times a week. And that's closer, but it's still a car ride away. It's not convenient by public transportation. And even though I do have chronic illnesses, I'm still very lucky that I can transport myself to my doctor's appointments, but it's not convenient at all, and I would much rather be served in my community.
And it feels, go ahead, Dr. Martin. It's good to see you.
Always a pleasure, Counselor. I don't know if you were here earlier when folks talked about the actual public transportation journey.
That's right.
Right? So the journey that Sherma talked about is if you take the red line, right? So you got to take that 24 over to Mattapan, take the trolley over to Ashmont, and then catch the buses or the trains, and then catch more buses, or you can go catch a bus all the way back up to the 32, back up to Forest Hill Station, and then you got to catch a train to a bus, or catch another bus to, depending on where your health care is, to catch 2 more buses. So it's a lot. Mm-hmm. And even driving, you heard that most people here are driving and it's taking them 45 minutes, at least 45 minutes. On public transportation, you're talking about at least an hour or more, and you're dependent on the schedule of public transportation, of the way the buses align with the trains and the buses to the buses.
Yeah. That's why I asked the question about the journey, because I know that Hyde Park is also a transportation desert. It is a health desert. It is all types of deserts happening here, and I think that that is central to the conversation. And, people say that health is wealth, and there is very limited wealth here in Hyde Park, and so happy to be having this conversation. I can tell that the chair is letting me know that my time is up, so I will end with that.
Appreciate that, Councilman here. I did promise folks we'd be as close to 8 o'clock as possible, so then we still have another round of questions. But I did have some questions, but you all answered most of them. Great questions from my colleagues as well. I would just like to reiterate the fact, Council President Louis-Jean brought up the Kearney closure, which is in the district that I represent, and the role of neighborhood health centers that played the role they played in taking on the added folks that could no longer receive their care at the hospital in Dorchester. And they are now, they're packed to the gills, right, with people. And even before that occurred, before the closure even occurred, I would talk to the health center, Codman Square Health Center, Dodd House Health, and they said, John, we lose money as health centers. With every patient that walks in the door, we lose money, but we will not turn people away. So I only say that to say you will, if and when you get your neighborhood health center, that the battle is not over, because the business model is built to make it extremely difficult to continue on. If there's a way that we all can figure out a different business model, that certainly makes the difference, right? But I know a lot of things have to happen to do that. But there'll be a lot of fundraisers. I know Council Papen will definitely sponsor some of those to raise money once you guys are up and going. But I just wanted to caution that, because when I talked, they said the onslaught now, obviously taking on more people. And if you tell me you're losing money with each patient walks through the door and says, okay, we'll take all the leftovers from the Kearney, well, that's not helping their bottom line. But they're not going to abandon folks, and I know Hyde Park isn't either. So I look forward to your journey and here to help you guys. And thank you so much, panel, for being here, for your excellent answers. during your time. You are excused. You may go down, sit in the audience if you will, and we'll bring up our second panel. But again, thank you so much for your education. So with that, we will bring up the one individual from the second panel representing the administration, Crystal Garcia, the Director of Policy for the Boston Public Health Commission. Crystal, please come on up. Thank you. And just a reminder, after this panel, that there will be public testimony, and we will go through in order the way folks signed up. Director Garcia, how are you?
Doing well, thank you. Thank
Good,
you
good,
for having
good.
me. Can everyone hear me okay now? Just want to make
Yeah.
sure.
Just make sure that microphone's close. I don't know if you have a presentation or something that you would like to start off with. The floor is yours.
Yes, thank you. I have some brief remarks that I'll share.
Make sure you're close to the microphone.
Better?
Yep,
All right.
there.
Thank you. Chairman Fitzgerald, esteemed counselors, and community members, my name is Crystal Garcia, and I'm the Director of Policy for the Boston Public Health Commission. First off, I want to thank you for inviting me here this evening to discuss the importance of healthcare access for the Hyde Park community. First, I want to share a few words on the immense value of community health centers, as you already heard this evening. In Boston, we are fortunate to have a nation-leading network of community health centers that provide access to high-quality, timely, and affordable health care for residents of Boston, regardless of their ability to pay. The healthcare services that are provided by our community health centers are designed to be linguistically appropriate and culturally tailored to the communities they serve. Our health centers provide access to primary care services, on-site specialty care, and referrals to our vast network of academic and community hospital centers. From a public health perspective, community health centers are a key ally in the Boston Public Health Commission's mission to advance health equity across Boston. We support all efforts to strengthen and build this network of community health centers, especially at this time when health centers and the systems that sustain them, like Medicaid, are under threat. I want to commend and congratulate the Hyde Park Health Center Steering Committee for their successful efforts to shine a light on Hyde Park's health access needs. BPHC has been meeting with this group for the past 2 years now, and we are inspired by their passionate commitment and hard work to advance the health of their community. In March, I had the opportunity to present at the Hyde Park Health and Wellness Summit on the health status of Hyde Park residents. And at that presentation, I highlighted some data, but this evening I'd like to highlight a few metrics here for anyone who may have missed it or may not have yet heard this data. Hyde Park is home to 4 pharmacies and 4 primary care practices, but it is one of only 2 neighborhoods in Boston that does not have a health center. 95% of Hyde Park residents have health insurance, with 54% of them insured by Mass Health. One key marker we look at in population health is premature mortality. Premature mortality is defined as death before age 65. Premature mortality in Hyde Park mirrors that of Boston overall and has remained stable for Hyde Park from 2020 to 2024. The leading causes of premature mortality for Hyde Park residents in order are cancers, overdose, and heart disease. The rates of cancer and overdose in Hyde Park are similar to the rest of Boston. However, rates of heart disease mortality for Hyde Park are higher than the rest of Boston. This data and much more are regularly collected and analyzed by the Boston Public Health Commission. We encourage everyone to take a look at our Health of Boston and other reports, which are publicly available on our website. From our research, we know that other health issues are important to address in Hyde Park, and some of those include asthma, infant and maternal health, and access to healthy food. Next, I'd like to share a little bit more about BPHC's programs and services. Here's a few of the things that we're doing specifically to serve health needs of Hyde Park residents. BPHC operates a school-based health center here at New Mission High School, providing culturally and developmentally appropriate healthcare services to our youth. The team at New Mission includes a mental health clinician, a medical provider, and a health educator. Through our Boston Healthy Childcare Initiative, we partner with family childcare educators in Hyde Park to help ensure the environments our youngest children spend their days in are healthy spaces. This fiscal year, we partnered with 12 childcare programs in Hyde Park, reaching 90 children ages 0 to 5. Through our asthma home visiting programs, community health workers visit homes to assess for asthma triggers, review asthma symptoms and medications, and create asthma management plans. We serve approximately 50 families in Hyde Park with asthma annually. And then there's our Healthy Baby, Healthy Child program, which makes home visits for pregnant and parenting families to provide services like breastfeeding counseling, health education, and injury prevention. In 2024, we visited 147 Hyde Park families. And finally, in partnership with the Parks Department, our Summer Fitness Series offers free fitness classes in all Boston neighborhoods. We're pleased to offer a free yoga class weekly in Hyde Park at McGann Playground. So come join us Tuesdays at 6 p.m. I also wanted to make sure to share briefly a new initiative from the Boston Public Health Commission, which I hope you've heard of, but if you haven't, it's called Live Long and Well, our city's first population health equity agenda. This agenda is about our commitment to eliminating gaps in health outcomes and creating a city where all residents can live healthy, long lives. We have a big goal: to close the life expectancy gap entirely citywide by 2035. When we think about how we got here or how we get here, we know that community must be at the core, which is why we are so honored to work in partnership with groups like the Hyde Park Health Center Steering Committee. In closing, I must communicate that we are deeply dismayed at federal developments that place Medicaid and our healthcare institutions under threat. Right now, Congress is considering a bill that would make drastic cuts to Medicaid, putting insurance coverage for individuals and the stability of the entire healthcare system at risk. We ask for the council to stand with us in advocating for Medicaid, which we know here in Massachusetts as MassHealth. As we mentioned earlier, 54% of insured Hyde Park residents are using MassHealth. And combating these federal cuts is vital to maintaining healthcare access for these residents. Looking ahead, we look forward to continuing to partner with the Hyde Park Health Center Steering Committee, the wider community, our healthcare institutions, and you, the council, to advance the health of Hyde Park residents. Thank you.
Thank you, Director Garcia. We'll now go to questions from my colleagues, starting with Councilor Enrique Pipet.
Thank you, Mr. Chair. Director Garcia, first of all, thank you for the work you do for the Boston Public Health Commission. As a Director of Policy, throughout your work and your expertise, what benefits has the Boston Public Health Commission seen from a neighborhood-based health center? What impact do they have on the community? And based on the data that you shared with us about how our disparities are in terms of cancer and heart diseases, how do you think it would impact the neighborhood of Hyde Park to have its own community health center?
Sure. We know, as I said, our community health centers provide culturally and linguistically appropriate care, provide care that is really centered on the community where they're located. So I think that we know firsthand community health centers play a vital role in supporting their direct communities. In addition to that, community health centers often employ our neighbors. They employ the people who live in those communities. And so I think it's very important, and the BPHC definitely agrees that supporting community health centers where people can have easy access. We heard earlier many stories where people are, navigating immense risk and also burden just to see doctors to receive basic care. So I'd say we are fully supportive of community health centers for that reason, and I think that having regular access to screenings, timely follow-up, and all of those pieces are definitely part of our healthcare infrastructure to ensure that folks are not dying from cancer, suffering from asthma, and many of the other maladies that they experience.
Thank you, Director Garcia.
Thank you, Council Pepen. Council President, the floor is yours.
Thank you, Director Garcia, for being here with us this evening. I think this is in the policy world, but what would be your recommendation to the steering committee, to the council, on how to get this started, like the best way to get this off the ground? Is it finding that one partner in one practice area and shooting up from there? We understand the very real challenges right now for FQHCs, federally qualified community health centers. I think I don't know if I got that, but that there are tremendous challenges. So in light of that and understanding that, what would be your best practice or recommendation on how to get started?
Thank you for that question. I think it's a really tough question considering what is going on in our environment and a lot of the uncertainty around Medicaid, which is the primary payer for those who visit health centers, community health centers. I would say our continued partnership with, and especially the steering committee's continued partnership with organizations like the Mass League, and also continuing to convey and get all of our support to share with our local healthcare infrastructure leads. So I know that MGB was engaged, but also engaging other hospitals to continue to convey the importance of a community health center in Hyde Park.
Thank you. I appreciate that. That's basically the thing that I care about most, is like, and I'm sure that's what the steering committee cares about, like how do we put this? There's a lot of energy. We've had a lot of conversations. There's been money set aside. So like how are we taking the next step? And who's gonna take the charge in helping us get there? Thank you, Director Garcia. Thank you, Mr. Chair.
Thank you, Council Mejia.
Thank you, Dr. Garcia. I want to pick up where Councilor Louis-Jean left off. Especially when we've heard from some of the community panelists talked about the data in Hyde Park. We addressed some of the transportation desert here, the difficulties that a lot of residents face in trying to access health care. So within that framework, you said that there were two neighborhoods that did not have health centers in the whole city of Boston. Which is the other neighborhood?
West Roxbury.
West Roxbury, okay.
Yes.
And West Roxbury is also a transportation desert, so it seems like there is a theme here. But we're here to talk about Hyde Park. Just keep it focused on Hyde Park here, y'all. I'm curious, in terms of just the appetite, it seems like the steering committee has been at this for some time. They've identified potential even spaces. What would you say is the biggest roadblock in the Boston Public Health Commission diving all in to support this initiative?
That's a really tough question.
That's what we're here for.
Thank you for that question. So we regularly support community health centers throughout the city, and I think we're bought in. We've been part of this process, at least for the last 2 years, with the steering committee, showing our support, facilitating any communication or relationships that we can to try to move this forward. I think I would love to hear more about considering what being fully bought in means, just because I'd hate to, make assumptions about that. But I think that as far as within our sphere of influence, we definitely are supportive.
Yeah. And one more follow-up? Okay, thank you. So just following that thread, I'm a big believer of like mutual aid and how community, like we have all of the assets. Just I'm sure we have doctors here, we have mental health practitioners, we have doulas, we have it all right here in Hyde Park. We don't have to leave to make this happen, right? And it sounds like this might be outside of your wheelhouse. This might be more of a capital planning project that comes out of the city that is supported with some technical assistance and some financial support from the Boston Public Health Commission. But it seems like to me that one of the biggest obstacles is really the space and where you operate, and then identifying a partner that can help you execute. So to that end, who would you say, when you're looking at the healthcare, the Boston Medical Center, Brigham and Women's, who are the hospitals that are well-positioned that you potentially can point us to that would be a good partner in this particular venture in this moment in time?
Yeah, that's a great question. I think that that's a part that we definitely have to assess feasibility for. I don't feel comfortable. I don't think I have enough information to fully answer that question, definitely not on behalf of the hospitals. But yeah, we'd love to partner to learn more about that to determine feasibility.
Yeah, and I know we don't have everybody here, but my question is like, I think about some of the BCYFs. I think about all the space that we have here that oftentimes is underutilized. I think about the vacant lots that we see. And, I feel like even if it's just a pop-up in a space that we can demonstrate what it looks like, that's the type of brainstorming that I'd love to be able to start doing alongside my colleagues to really think about how do we meet this moment, because we don't have to keep waiting. I'm a firm believer that we can work and test things out and start utilizing and occupying space too. That's just me, and I'd love to be able to engage in what is possible. I don't like no's, and so I want to invite you, Dr. Garcia, to lean on us, to push us, and to help support you and your work in this space. And I also want to just shout out that central staff. This is their second off-site hearing in 1 week. And this one is less traumatic than the one that I experienced with you all a few days ago. So I just want to acknowledge that central staff is working overtime this weekend. And thank you, Candace, and your team for being here again. Thank you.
Thank you. Thank you, Director. We appreciate you being up here. You are excused if you want. Thank you so much.
Thank you.
We will now move forward with public testimony. When your name is called, please come down to one of the two podiums, or do we only have one? Just one? Yeah, come to the podium to my left, your right, and state your name, neighborhood and/or organization affiliation. Please speak into the microphone, and please keep your comments to 2 minutes. I will be keeping track of how long over 2 minutes you guys talk, but try not to let anyone go too far. But thank you for your patience up until this point. First up, we have Celeste Peters. Celeste, are you still here? Great. Let's hear it for Celeste. Sure, we'll give everyone a round of applause on the way down.
First, I hope you can hear me.
Yep.
Okay. My name is Celeste Peters, a resident of Hyde Park since 1968. I graduated from this high school. I would like to say the following. I am retired from Mass General and Partners Healthcare, which is now MG Brigham. I would like every one of the panels and the doctors here to set a meeting with Dr. Ann Klebansky, the president. I say that because I worked in the president's office at Prudential Building, 11th floor, in the Prudential Tower for the corporate office. I'm retired for almost 30 years in the medical field. I'm not a doctor or a nurse, I'm an administrator, and that's all I have to say. But I feel that Michael Curry, the attorney, I can't remember what his new title is, and also a few doctors and the councilmen and the state representatives need to ask for a meeting with Dr. Ann Klebansky, the president. You go to the president's office at 800 Boylston Street on the 11th floor. I worked there for years. I know how much money comes through there. I know they have the ability to open up a healthcare center out here. You need to get to the horse's mouth. Not all the politicking. They have great board members that are extremely endowed to help you get the center out here. And whatever I can do now that I'm retired, and I'm still home now, and I'm so happy to help, I can help in any way if I have to walk up and down with a poster board. Thank you.
Thank you. Thank you, Celeste. Up next, Diane Farley.
Hi, everybody. My name is Diane Farley, as they said, and I would like to say, as a senior citizen now, I hold my head up high.
Speak into the mic, please. That's all closer.
Sorry. I'm usually being told that I'm loud because I'm hard of hearing. But anyway, I recently had a pretty good-sized aneurysm removed from my brain, and it was found by accident by a whole different specialist. I also took a really bad fall and had to go to Brigham and Women Faulkner, and I was there for 24 hours trying to get all the testing done. I am very grateful because I do have insurance, and not everybody does. First of all, I grew up in Hyde Park. I moved here in 1963, and I came from Orchard Park in Roxbury. And, you know, things were starting to get rough then. But anyway, I'm going to let you all know I have been previously incarcerated, and the girls that are left inside are suffering greatly. A lot of them black and brown community. They also are being given hysterectomies unnecessarily, and it's disgusting. I had a friend pass away already that came out on medical parole, such as myself. People that are trying to get out can't, and they're so sick, and they're losing limbs. I mean, these are my good friends. So it's not just people out here, it's senior citizens that aren't being looked at. And you know, I don't let go. I'm like a bulldog. I don't let go of anything. I try to get what I need today. I was made an addict by doctors back in 1966. All my friends became addicts back then. Amphetamines were given like candy, Valium, Xanax. It was all the time.
15 seconds.
In the
Diane.
90s, okay.
Sorry,
in the
no, just wanted to let you
90s,
know.
my kids lost 12 to 15 friends from addiction because they didn't have help.
I'm sorry to hear
So
that.
thank you all.
Thank you for your testimony.
right.
I really appreciate it. Next was Jessica Paulino, but we were a panelist, so I assume you just thought this was a sign-in sheet. That's fine, all right, that's moving along. A Benjamin Carroll would be up next. Benjamin, thank you.
Hello, can you guys hear me? Okay.
Just speak right into the mic very loudly.
Oh, yeah, okay. Is this good?
You can raise it.
I can
Yeah.
adjust it? Yeah, I'll do like, so I can do that. Okay,
Yeah.
maybe.
No, take it off the thing and hold it.
Oh, okay.
Then you'll be able to.
Much better. Okay. Thank you, Marcia. Okay, so thank you, members of the Hyde Park community, for coming here today, and the Boston City Council for listening to me speak. My name is Benjamin Carroll. I'm an employee of Beth Israel Hospital, which is where I'm coming from today. As of last month, I'm a graduate of UMass Amherst, and thank you. Thank you. And most recently, I'm a member of the Hyde Park Health and Wellness Steering Committee. Thank you, Marcia, for inviting me here today. I'm so happy to speak. So I've been connected to the Hyde Park community for my entire life through Lowney Medical Associates, which is where my papa, Dr. Charles Lowney, served as a family medicine physician for over 50 years. And for a little less than 50 years, I served as his medical assistant, helping serve the community alongside him. So today, I wanted to share a story of my time in Amherst, where I saw how big of a difference a community health center made. So for 3 years, while I went to school, I supervised weekly community meetings for individuals with developmental disabilities called the Boltwood Project. And every Friday, I walked home with my 74-year-old friend, Lee. So he has a developmental disability that makes it difficult for him to manage things like healthcare and groceries and transportation on his own. And he gave me permission to share this story today when he called to tell me he wasn't feeling well, and he asked if I could come over to check on him. So I drove over to see him. I asked if he saw his PCA recently. They were supposed to see him twice a week, and he told me that he hadn't seen her in a very long time. And I was concerned. I knew Lee was a type 1 diabetic, so I brought my glucometer. I went to check his blood sugar, and it was over 300 milligrams per deciliter, which is incredibly high and incredibly lethal if it's left untreated for too long. So I drove him straight to the hospital. He quickly recovered, but I was terrified and I had no idea what to do. So along with the coordinators of the Boltwood Project, I turned to Amherst's Bangs Community Health Center. So together with the Bangs Center, we found out he had missed the renewal deadline for his mass health insurance. He was never informed of this, and he lost access to his PCA and access to care for God knows how long, and we didn't find out until it was already his health at risk. So with the help of the Bangs Center, we were able to re-enroll him in Mass Health. And now it's not only a place for him to go when he's not feeling well, but they send a PCA to check on him every week. When his cat died and he was suffering from loneliness, they were the ones that financed a new cat for him. And now he doesn't have to rely on a random college student answering his phone to save his life, because he has someone checking in with him every week, providing preventative medicine to limit future health issues from occurring in the first place. So I knew Lee for years. I walked home with him every week, and I had no idea until his health was already at risk that he had no access to care. And that community health center is the only reason I wasn't walking home alone every single week after that. So today, it is all that stands between life and death for Lee and countless other residents in Amherst. And like we heard earlier, Hyde Park has one of the highest rates of diabetes and heart disease hospitalizations in the city. So as I'm speaking right now, how many people do you think in our community are suffering from untreated chronic diseases right now, slowly chipping away at their health like Lee was? And the data we heard was only hospitalization. So how many people do you think never even made it to the hospital? Seriously, how many do you think it was? Because if that number is any higher than 0, that is exactly why we need a community health center, not as a privilege, but as the right of every single resident in the Hyde Park community. So not only will that serve as an accessible location for people when they're sick, which itself is enough of a reason, but it is an epicenter of compassion. It will have people who care, people who provide support, and people who go out into their community to ask, "Are you okay?" and intervene before a hospital visit is ever necessary. Thank you.
Benjamin, thank you. And thank you for taking action when so many people would rather be quiet or just videotape or do something like that. Thank you for being someone that actually takes action. It's rare these days. Appreciate it. Randy Brinson?
Thank you all for being here. When you don't have a community health center, what do you do in Hyde Park? You call 911. And what does that look like? On April 28th, 2025, there was a 911 call for a child struck by a school bus. It took 13 minutes for the first arriving ambulance to arrive to help that family. It took a total of 30 minutes, 35 to be exact, to get that child to a hospital for advanced life support. That is far too long for the residents of Hyde Park. This is by far one of the most extended ETAs in the city of Boston, and that does not happen in anywhere else in Boston. We're asking for a health center, but instead we should be asking for a hospital. I want to voice my concerns and frustration with the lack of urgent care resources and emergency health care in Hyde Park. The current population is roughly between 34 and 36,000. I'm here to enlighten members of the community and city councilors of the dangers you and your family may face when you're in need of medical attention. We, and I say we because this includes myself and my family also, we're all lucky to be alive. Some of us aren't so much. What I want the public to know is that when you're facing a medical emergency in Hyde Park, there is only one ambulance to respond for you. One ambulance. That ambulance sits on Dana Ave, shacked up with the DPW facility because, quite frankly, it does not have a home. What most of us don't know is that one ambulance is responsible for the entire Hyde Park, from Reedville to Walcott Square to Clary Square, Fairmont Hill, Georgetown Estates, from the 800 block up Hyde Park Ave heading south, from the 700 block of River Street heading south. In a perfect world, you have a medical emergency in the city of Boston, you get an ambulance outside your door in 7 minutes. But we all know this is not a perfect world because you see our president. You see that ambulance on Dana Ave, it usually runs from 7 in the morning to 3 p.m., from 3 p.m. to 11 p.m., and from 11 p.m. to 7 a.m., 24 hours a day. But the problem is, it's never there. The ambulance is never there. Boston EMS is so overwhelmed that they're responding to calls throughout the entire city. So when you have a child struck on Washington Street in Hyde Park with life-threatening injuries, that ambulance is coming from Roxbury, West Roxbury, Rosendale, Jamaica Plain, and sometimes Brighton. It takes another ambulance 15 minutes to arrive. This is a tragedy. The shortage of ambulances have developed a flawed EMS system that puts the public at risk every day. When you need an ambulance in Hyde Park, it might not be there for you. You may have to wait for another unit coming from a different side of the city. Imagine you or someone you love having a stroke where every second counts, to the deterioration of brain cells from the lack of blood and oxygen into your brain, and that ambulance takes 15 minutes to arrive. Imagine that. Then it takes another 15 to 18 minutes to get you to the hospital. Imagine that, how much time, how much brain cells have been lost for you or your family. That doesn't happen in other neighborhoods like West Roxbury, Rosendale. They have other health facilities. The Faulkner, Roxbury, South End, South Boston, they have BMC, Brigham and Women's, Beth Israel. The North End, Charlestown, East Boston, they have Mass General and Tufts. Kearney Hospital was such a crucial resource to our community, and it took an absence for people to understand its value. Did you know that same ambulance on Dana Ave responds to Mattapan, Dorchester, Rosendale, Jamaica Plain, and on busy days, they're in Roxbury, leaving the citizens of Hyde Park in vulnerable place? Why is this ambulance from Hyde Park in every other town of the city? I don't know.
Randy, I'm going to ask you to just wrap it up soon. Thank you.
But you don't see that with the police department or the fire department. There are multiple police officers in Hyde Park at E18 station. There are 2 fire stations in Hyde Park, but there's 1 ambulance for the entire Hyde Park. And if you're looking for a place to build a hospital or a wellness center, Industrial Drive has over 65,000 square footage of land waiting to be built on. We need more health centers. We need more hospitals.
Thank you, Randy. Up next, I apologize, it's a little scribbled here, but is it a Sharma or Hinton? Hinton is the last name. Sharon. Sharon Hinton. I apologize.
In my mind, I'm running up to this microphone. My name is Sharon Hinton. I'm the founder and executive director of Black Teachers Matter. I'm an educator of over 45 years, and I'm a survivor of 3 strokes, hence the cane. I'm a doctoral candidate in education at Northeast University. I have a master's in management and master's in education, and I was halfway through getting my master's in public health when I had the stroke, the first stroke. Last year, about August, I almost died. I called the ambulance, and I had this overwhelming pain, and ended up going to Brigham and Women's, and they told me I had an infection in my bowel, in my blood, in my uterus, and if I hadn't gone to emergency, my organs would have went septic and I'd have been dead in 48 to 72 hours. My daughter was born through in vitro. Doctors told me I would never have kids. She just turned 28. Right? I want to encourage, yes, we need a hospital, but Boston has more hospitals, universities, and colleges per square mile than any place else in the world. The father of gynecology experimented on slave women and babies with no anesthesia. The sister that, where is she, that talked about in prison, they are still sterilizing Black and brown women, and that has always been the case, especially when you're incarcerated. See, being free from slavery was not part of the book, but that's not what I'm talking about. The women that were here, I didn't get to talk to them. I got to talk to one sister that was going through IVF to encourage her. When I went to the hospital last year, and they didn't know what was wrong with me, they just knew it was an infection, the first response from this blonde, no shade on blondes, was to give me a hysterectomy. She didn't even know what was wrong with me. The racism in the medical industry towards people of color has always historically been here to burn us, to poison us, to cut us. First Incorporated, which was a stellar drug program in a White House down near RCC, is now abandoned. It was bought by RCC, but it was a community drug program that was so successful. And then when, I'm not gonna name the place, but it was a well-known health center, got a hold of it, they destroyed it. I'm encouraging, and they're not here, the sisters that are here, we have, and I think Julia Mejia said it, we have, the indigenous people have what we need to heal ourselves. We came here with that. And so if you're going to have a hospital or another clinic, let me say 2 things. I was in Columbia Point when Dottie Haskins founded that health center in Columbia Point. But the free health, the concept of free health care was the Black Panther Party of self-defense. Let's be serious. Free breakfast, Black Panther Party of self-defense. I'm not saying that to cause a division. I'm just saying that when people come together, we can do this. You have to have the will to do it. This sister that said that they have the money and go up to the office to do it, you still have to have the vision to be healed. This country, Western medicine, makes more money from you being sick, but we know what it takes for us to be well. We have to do that. So you can start a world-class hospital that is different than everything else that's been here, bringing all the knowledge that we have from all of our cultures to get us healthy, to keep us healthy, because it's a bigger thing than just once you have the systems to get better and to survive.
Thank you,
so I'm
Ms.
encouraging you women to do that. I honor my sisters and my brothers here who have survived, and I appreciate Counselor Pepin and the other counselors, and I don't know who you are. Fitzgerald, is that what your name? Okay, I don't really know you as much as I know the other people.
Thank you,
my
Ms.
name
Hinton.
is Sharon Hinton, and I am a candidate for District 5 City Councilor. Thank you.
Great. Thank you, and my apologies, folks. I thought there was one sheet, but there is a second sheet, so I am going to be a little bit stricter on time to go forward. I was allowing people to go over, not realizing there was a second sheet here. Scott Beatty. One, two, three, four, five, six, 8.
Thank you, City Councilors, Council President Lujan. My name is Scott Beatty. I'm a 35-year resident here in Hyde Park. I will be very brief. I feel I can't add a whole lot more than what's been talked about here tonight. I'll just say that I've spent a great deal of time the last 10 years volunteering for different efforts here in this community to make Hyde Park a better place to live. And going to Marcia's health forum a couple months ago, kind of shocking to find out that amongst us that this community has the highest mortality rate, infant mortality, maternal mortality. We're not a poor community statistically. We're actually not a poor community at all. So I think the issues about access, and my PCP happened to be Dr. Lowney, Dr. Jay Lowney. He was, his brother, Dr. Mike, was actually speaking at the forum. And I think that for a lot of people, it was shocking to hear this data about our own community. I know I'm shocked. I had a near-death experience in 2015. I also have to go to those buildings on the MGB. I'm a regular at 2 of those Chestnut Hill buildings. It's a long drive. I just became a senior citizen officially. I don't know what will happen 5 years from now. Maybe I won't be driving, but it's just the alarm here has been pulled. The data is shocking for our community. So whatever it takes to bivouac action in this community to get something done, we need to do it. And to hear the data around the ambulance in this community and the response time, again, the data is just shocking as a resident to hear this, and I really hope that there's some action. Hope we don't have to wait 5 years for this to happen, but I'm also aware of the realities of what's going on in DC, all of that. But anyway, thank you for the time.
Thank you. Abby Paget.
My name is Abby Paget. I have lived in Hyde Park for 7 entire months. I know very little about what is going on here politically. However, I'm very interested in psychiatric health care. And when I read over all the promotional materials at the promotional event that they had at the Pride where I live, I did not see the word psychiatry one time. And I thought, okay, I will speak up. I am the mother of a son who lives with a chronic and severe psychiatric disability. He lives here, that's why I'm here. He lives in Chelsea in a group home. He has received excellent psychiatric care in Boston throughout his long career with a severe illness. I encourage, and actually having heard the steering committee, I realized it wasn't necessary to even stand up here because there are people there who are speaking to this issue. But I will add an additional dimension to it, and that is that with a psychiatric facility in the healthcare facility here, there can be crisis intervention training for the police. That is crucial, is absolutely crucial, and that is one of the functions of a healthcare facility in a community, is to work with the police who don't have training for dealing with people who happen to be in psychotic episodes on the street. But once they are trained, then they know what to do, and we don't have tragic circumstances. Thank you.
Thank you, Abby. Mimi Turgenitz.
Good evening, everyone. Thank you so much, counselors, all my favorite counselors from Hyde Park and the rest of the city. Thank you for being here and having this wonderful hearing. I'm Mimi Churchnetz, the president of the Hyde Park Neighborhood Association. I don't need to reiterate the data. It's real clear that this is an equity issue. We desperately need a health center here in Hyde Park. Everybody has outlined the reasons why. So I just want to say to the committee, to Marcia, to all the folks who are working on this, you can depend on the Hyde Park Neighborhood Association. Anything that you need, any kind of strategy or phone calls or assistance, if you wanted to come to a meeting and present, whatever it is that we can do, we're on board with you. And so thank you so much for doing all the hard work, and we're here to help you in any way that we can. Thank you.
Thank you so much, Mimi. Christopher Hart.
So thank you for holding this meeting. It's a great step. We got a long way to go. And I say that as a resident of Hyde Park since 2010. I have lived here with my family, 2 kids. I recently had to move from out of Boston because we could not get the special ed services that we needed for our son with autism. And that is a perfect segue to what we think about in a community health center is not only the psychiatric piece, it's behavioral supports, particularly for families dealing with autism and other cognitive disabilities. People see me, the wheelchair guy, right? But the reality is, demographically, the top 5 causes of disability are completely invisible. Heart disease, breathing issues, back problems, and diabetes, related conditions. All of those are invisible. Boston, as a population, has a third of its population over 65. We also have a third of our population under 30. And we need to focus on both of those populations when we talk about community health. The last point that I will make is, yes, we are in some ways a transportation desert, but I would respectfully disagree about the drugstore access. If anyone has dealt with the CVS at American Food Basket, it is painful to deal with. And as we all know, when we lost Rite Aid in Cleary Square, we don't have a full drugstore in Cleary Square. You have to have a car to get to Walgreens over on Truman Highway. That's a fact of life. There is no 24/7 pharmacy in Hyde Park. on public transit. So we have to think about that as we address and plan the community health center. Because it does no good to have care 7 days a week without access to prescription 24/7. Thank you.
Thank you.
Thank you, Christopher. Marilyn? Is it Marilyn Cortez? Corco? Right.
Big Lowney office building. Okay. Good evening, everyone, and thank you for holding this hearing tonight. My name is Dr. Marilyn Smith-Corcu, and I say that facetiously. I'm not a medical doctor, but every once in a while I like to show off my PhD. I'm actually a very humble servant. I'm an educator by training, so I just know about public service. And I know that we have to think about all community. I actually had remarks on my iPhone, but I'm 74, the battery died. And now I'm hoping that my limited brain cells and the borrowing of a pen will help me retrieve some of my thoughts. But so many things have been said already. But I want to pick up on this notion of integrated health that was mentioned earlier. I dream a world where we stop thinking in silos and boxes. I'm an educator. I never thought in silos and boxes. I could bring students from 30 years ago that will say, that wasn't how she did her thing. We thought out of the box all the time. I think we have to be thinking out of the box when we think about public health as well, or healthcare in general. I happen to serve on a community coalition for equity and research. It's a group that's chaired by Michael Curry and others at Harvard Medical School. And we look at medical research. I appreciate Ms. Hinton for calling out gynecology. I also have recently just made some videos for Harvard Medical School around clinical trials, which may sound kind of weird because we know that clinical trials have not always worked well for people of color, gays, women, the whole 9 yards. But I want to call out the names of at least 2 of the 3 people of the women I do recall who were the first women who were treated for gynecology, as Sharon said. They were Archana and Sarah. I will tell you, if you go to Montgomery, Alabama, you will find a statue dedicated to them. That Dr. Marion practiced on black women, enslaved women, to get the basis for all gynecological practices that are going on today. I also have served as an advocate to change the consent forms in Massachusetts hospitals. Most women and most men, you don't know this either, but when you go to have surgery in a teaching hospital, and maybe there's some doctors over there that know this, that consent form, once you're in a teaching hospital, is giving the hospital permission to have those learning medicine, which makes sense, I'm an educator, to have a place to practice and learn strategies. I'm affiliated with a group called At Your Cervix, okay? A documentary that I kind of was pushing around the state legislature to say, we have to look at this. In Massachusetts, we have been able to decouple that bill because unbeknownst to most women and men, medical doctors or interns, residents, were going in and doing gynecological exams on women. It's documented across the country. Men, same thing could have been happening to you. And you could have been in there for a gallbladder procedure. That's the scary part. So you can check that out to see if I'm lying, but there are enough people in the State House, Comfort is one, that knows about that. But I was provoked to
15 seconds, ma'am.
I know, I can't stop. People will tell you that.
That's why I'm here.
But no, I'm an educator. I think the idea of coupling things, we just heard about a health center here in the high school. I think we have to think small and broad as opposed to small and limited. We need to be putting wellness on the table. I have a family with mental health illness for generations. We have lived in silence. I don't do it anymore. I worked with the mobile van that Harvard Medical School also runs, the mobile minivan. I worked with them to help myself. We worked on a program to deliver mental health counseling and support on that van. I think we have to access mobile vans, small clinical locations that are really targeted to meet individual need. So
Thank you,
I just
Marilyn.
pray that you'll just keep pushing, and I'll be a little more coherent next time. Thank
No,
you.
that was great. Thank you so much. Domingos de Rosa?
No, he's here.
No, he's way in the...
Good evening, folks. Thanks for having the hearing. Very important. Hi, neighbors. I've been in Hyde Park, I want to say 21 years. It's been a conversation for this community for quite some times. Pretty much everyone has said 99% of what I was going to speak on, but the reality is a lot of these issues are only going to get worse. The city is becoming more and more congested. The time frame, again, like one gentleman said earlier, it's literally about 40 minutes from here to BMC. One of the great questions you guys asked was, where do we go get our services? I live right here on Kelly's Field, across the street from Supreme Carpet, for folks that have been here. I'm literally across the street from Supreme Carpet, and I go to Norwood to use their health center, part of the Atrius health group. One, it's literally closer, less time. I go to Newton Wellesley because, again, it's closer, less time. But I don't want to go there. You know, I don't want to have to travel to a community, again, like another individual says, we're looking for providers who look like us, sound like us, come from our backgrounds, but it's not an option right now. There's a shortage of PCP providers. Specialty, don't even talk about that. Sometimes it takes up to a year. I have what they call night blindness. Basically, my receptor cells in my eyes are dying, and I would go to Mass Eye and Ear, and sometimes it'll take me an hour and a half just to get there. I don't take the T because it's not reliable, but I do know folks who do use the ride, and it's sad to say that what the panel had stated, it's beyond true. There's some folks who live in the community who are elders, and for them to get on the ride, they're doing shares. So sometimes their appointment is at 9, but they got to leave the house at 5, 6 in the morning. And that's not fair to an individual who might have other medical issues. And I know for my parent, my only living parent, my mom, she has an overactive bladder. She suffers from IBS. And it's very, very difficult to get her somewhere when she feels uncomfortable wearing a diaper. It's a reality for a lot of our elders. And it's something that if we had a health center here, where are we going to put it? Do we have a location? Because we only have commercial real estate left, and that's going towards Reedsville. So if we're really looking to put this health center, where are we going to have, what city property that we can tap into? Because that's the first piece. We need the property so we can build. And if the city's going to aid us, we need to find that property that's owned by the city so we can take away that red tape. Because it's going to take prime real estate in Hyde Park, you know, you're looking at a good $3 to $4 million. And then to build the building, I mean, we spent $100 million on White Stadium. We can find money to build the health center. So I just wanted to say thank you guys for having this. This is one of the most important pieces of Hyde Park. Without it, we're not going to be able to thrive. Again, Kearney Hospital is not an option for us anymore. Milton Hospital is the closest. And when we call a 911, if it's a trauma,
Thank you, Domingos.
the closest place is BMC. So thank you again, and guys, have a good night.
Appreciate it. Before our last testimony, I just want to say that in the back, for anyone who needs the elevator to get out of here, to leave, you could see Diane waving her hands in the back of the room. For anyone that needs help taking the elevator, you could go see her. She has the key to the elevator. Rachel Meiselman.
So, hello. I think I can probably be most appropriate and helpful if I make my remarks brief. So I will swiftly but sincerely thank the panel for so many poignant and insightful testimonies. I was greatly moved. I would also like to thank members of the council, Councilor Pepin, Councilor Fitzgerald, Council President Louis-Jean, Councilor Julia Mejia, for allowing this opportunity to take place. And of course, I would also like to thank Director of Policy Garcia for rounding out the perspectives. I want to say, just to close out on two quick points, as it's already been very eloquently stated, health centers aren't just places for us to be treated holistically. They're also anchors in the community, and they add to the vibrancy, and they also add to the desirability of communities. And I will also say that Boston's a very special place, incredibly special place. Education is our currency. And one of the byproducts of education being our currency is that we have these remarkable medical institutions. And so we have people coming from all over the state to be treated. We have people coming from all over the country and even all over the world. So the idea that there's even one neighborhood, well, there's actually two, but the fact that there's a neighborhood without a medical center, that really greatly distresses me, and it's really something that we have to address and get on. Thank you for my time.
Thank you very much, Rachel. That concludes the public testimony. I will now hand it over for a brief closing remarks from my colleagues, starting with Councilor Pepin.
I just want to say thank you to the residents for showing out. To do things in community is really important for us, and to listen to the testimonies that we heard today, and especially to the steering committee, thank you for all the work you do. Seriously, you make my job easier at the City Council, and continue to work together to make sure we make this a reality one day. Thank you.
Thank you. I want to thank Councilor Pepin for making sure that this happened in community. I want to thank the chair for hosting this. I want to thank all the members who came out and listened and who have advocated. I hear Marcia Kim Jackson's call to action that no one can do this alone, and that the steering committee also needs help from residents to advocate, and so that's going to help us all coming together. So I'm listening, I'm working, I want this, I want us to be moving with some speed to at least get some things off the ground, so we have some results to show for the work, and so that Hyde Park can get what every neighborhood deserves. Lastly, I want to thank our incredible central staff for being here and for the work that you've done. As Councilor Mejia stated this week, I want to thank you, Ethan. Want to thank you, Megan. Ron is not here. Michelle was here early, and Candace. We can't do this work without our incredible staff at City Hall, and so we thank them. Thanks, everyone, and have a great night.
I got 30 minutes. No, I'm just joking. So, no, I won't do that to you all. I just want to thank the chair for allowing this to happen off-site. It really is important for us to utilize these spaces to be in community with you all, especially when it comes to an issue that you deeply care about and have been advocating for. So it was important for us to come to Hyde Park to listen to you all as you continue to fight. So for me, I just want to end with gratitude. I think, one of the most important things that I've learned in this time in the chamber is that community voice always has to be centered. And our opportunity here lies in where do we go from here? And how do we utilize this moment to really go back inside and figure out what are the spaces and places that we can partner with you all to do that advocacy that is so greatly needed. And I want to thank all of the public testimony for being here, and more importantly, you, the steering committee that has been relentless around this quest. Have a beautiful night. Thank you.
Great. Thank you, steering committee. Thank you, community, for being out here today. Thank you especially to central staff. Again, obviously you guys can't get enough shout outs, and especially to the staff of Council Pepin and my own staff, my chief of staff, Amanda Curley, for working together. It's not easy to put these things together in the community and get all the stuff here and microphones set up, so always thank you for making us look good. And with that, the hearing on docket 0306 is adjourned.